Welcome to the deep dive. Today we're looking at something really interesting, sustainability, but maybe not where you'd first expect it. We're talking healthcare.
That's right, a huge sector, and its environmental footprint is, well, significant.
Exactly. And specifically, we're diving into a recent study that connects digital leadership with making healthcare greener.
Yeah, by boosting what they call green creativity among nurses.
Okay, let's unpack this. How can digital tools actually help nurses become, environmental champions? It seems a bit counterintuitive, maybe.
It does a little, yeah, but the study really digs into that link. So, green creativity, it's not about inventing brand new devices necessarily.
Right.
It's more about nurses generating innovative, eco-friendly ideas right there in their daily work, practical stuff.
Practical stuff like what?
Well, the source mentions things like setting up better recycling programs, finding ways to cut down on medical waste, which is a huge
Oh,
issue,
for sure.
or optimizing energy use in the building, maybe pushing for greener supplies when ordering things, advocating for change.
Yeah. So it's empowering them on the ground level. Makes sense. And the other piece, digital leadership. What's that look like in a hospital?
So digital leadership here means using tech strategically. Think communication platforms, data analytics, tools that help teams work together. It's about guiding the organization using these digital tools.
Okay, so not just having the tech, but using it to lead.
Exactly. And the key insight isn't just efficiency, though that's part of it. It's more about creating this ecosystem, a place where green ideas can actually be shared, tracked, and acted upon because the data and communication channels are there.
Right, like a nurse spots waste, uses a platform to share the data, discuss it.
Precisely. And maybe tracked if a new process is actually working, it makes it more systematic.
That systematic point is interesting. The study mentioned there was a bit of a gap, right? People knew about green transformational leadership, but the digital angle specifically for nurses wasn't really explored.
That's exactly the gap they aimed to fill. They wanted to see, does this digital leadership training actually impact nurses' green creativity?
And how did they test that?
They used something called a quasi-experimental design. So they worked with 128 nurses in Egypt, split them into two groups. One group got this digital leadership training program.
And the other was the control group, yeah.
Right. The control group didn't get the training. They collected data from both groups before the program started and then again afterwards to compare.
Okay, here's where it gets really interesting then.
Mm.
What did they find? Did the training actually make a difference?
Oh, absolutely. The results were really quite strong. Statistically significant, yes, but also just a big practical difference.
Yeah.
The group that got the training showed this substantial improvement in their knowledge about digital leadership, sure, but also in their actual skills, their competency, and crucially, their green creativity scores shot up.
Wow, so a direct link.
A very strong one. The numbers, the p-values were less than 0.001, and the effect sizes were large, meaning the training had a really considerable impact.
And it wasn't just a general feeling, right? They look at specific parts of creativity.
They did. They broke down green creativity into things like motivation wanting to be green, then the actual thinking, the behavior, and the results, the outcomes.
Yeah.
All those dimensions showed significant positive change in the group that got the training. Meanwhile, the control group. Very little change, or none that was statistically significant.
That really isolates the effect of the training then.
It does. It makes a strong case for it.
So what does this all mean for healthcare and for you if you're involved in this space? What are the takeaways?
Well, the practical implications are pretty clear. Healthcare organizations, maybe even policymakers, should probably look seriously at putting digital leadership training into nursing education.
And for continuing development too, I guess.
Definitely. And think about it. Equipping nurse leaders with digital tools and data skills could directly help drive initiatives like tackling that medical waste problem we mentioned or using resources more efficiently.
It enables them to make a data-backed case for changes.
Exactly. Plus, these digital platforms are great for collaboration, sharing ideas, best practices for sustainability, maybe across different hospitals even.
That makes sense. Spreading innovation faster.
Yeah. And there's another angle, too, empowering nurses to educate patients about sustainable health practices, taking it beyond the hospital walls.
Right, so the impact ripples outwards into the community. It kind of reframes the nurse's role a bit, doesn't it? Adds eco-innovator to the list.
It really does. It's a powerful idea.
It really makes you think. If this combination, digital leadership, boosting green creativity, works so well in healthcare, where else could it work?
That's a great question.
How many other sectors could unlock this kind of innovation by bringing digital strategy and eco-consciousness together? Think about manufacturing, logistics, education.
Yeah, the potential seems huge. Combining that digital power with a real focus on sustainability, it could be transformative in a lot of places we haven't even considered yet.
Definitely something to mull over. Where else could this digital key unlock green potential?